It is good to be with you this afternoon, and I do appreciate your time. We're joined today by Deputy Speaker Diana Ayala, Majority Leader Amanda Farias, Council Members Carlina Rivera, Hospitals Chair Mercedes Narcisse, Health Chair Lynn Schulman, and BLAC Co-Chair Crystal Hudson. I got everybody. Good. I also want to acknowledge Patricia Loftman, a decades-long leader in midwifery services. Thank you for being here today. We're gathered here to address the critical state of maternal health in our city. We are failing women during one of the most vulnerable periods of their lives. As a society, we accept maternal mortality as an unfortunate casualty when in fact a majority of deaths could have been prevented with appropriate care and attention. When you look at the severe racial disparities in the cases of maternal mortality, it becomes very clear that this is an unsung public health emergency. These deaths are not accidents. They are a disturbing pattern of injustice. Just last week, we learned of the tragic death of Bevorlin Garcia Barrios, who went to one of our city's public hospitals in search of care. Despite alerting medical staff of her serious pain and symptoms, she was sent home. When she returned to the hospital just days after, with an increased severity of symptoms, she was finally admitted, but her case was not treated as an emergency. Why not? Why not? The very next day, she died from complications of an emergency C-section. Bevorlin was the third woman to die during childbirth at Woodhull Medical Center since 2020. In New York City, an average of 20 women die each year from pregnancy or childbirth-related causes. A common thread in these tragedies is often a lack of clear communication among some hospital staff and between provider and patient, leading to serious patient concerns being ignored. These communication issues are further complicated when there are language barriers and hospitals lack qualified interpreters. My heart truly goes out to Beverlin's family and to her friends and to people across our city who have also experienced the unimaginable grief of losing a loved one due to pregnancy-related causes. Across the nation, far too many Black women and others who can become pregnant suffer preventable, life-threatening complications during pregnancy and childbirth that too often cost them their lives. Again, I ask, why? Why? Here in New York City, Black women are 6 times more likely to die of pregnancy-related causes compared to our white counterparts. These disparities are a product of medical and structural racism that make access to adequate health care and treatment out of reach for low-income, immigrant, and Black women. Every death is a tragedy. But make no mistake about it, every preventable death is a tragic failure. As a government, we must bear responsibility for the loss of each precious life. And the reality is that most of these deaths are preventable. In the wealthiest city in the world, with some of the greatest medical institutions, this is completely unacceptable. We must act with far greater urgency to prevent these deadly outcomes. While we have made progress in recent years through an increased focus, we must treat this crisis as the emergency it is, and we must do more. Despite ongoing interventions from the council, the city, and the state, from providing free doula care in underserved communities to investing in mental health support, maternal mortality continues to devastate our communities. Today, I am raising the alarm. Ending maternal mortality must be our urgent focus. This issue is solvable. All levels of government and all stakeholders that possess the resources must come together to help end this public health and safety crisis. Too often, Black women and other people of color have their pain and symptoms dismissed by medical professionals, leading to delayed diagnoses and insufficient care. And guess what? My mother was one of these women. I've told the story several times now. She experienced several false alarms while preparing to give birth to me. On her fourth visit to Elmhurst General Hospital, it was Elmhurst back in the day, I'm that old, the nurses dismissed my mother's symptoms as just another false alarm. I mean, it was December 9th. My due date was January 14th. This was the fourth time my mother appeared on their doorstep. Despite her insistence that this time was different, she was ignored. And so she gave birth to me alone on a gurney in the corner of Elmhurst General Hospital. It is a miracle that we both survived. For years, stories like my own mother's were completely ignored, and it's clear that her experience still occurs today. The devastating impact of pregnancy-related complications, especially in communities of color, has been overlooked for too long. It's no coincidence, then, that with more representative and diverse leadership, particularly women-led leadership, maternal health has garnered renewed scrutiny and attention. As a women-majority city council, and the most diverse that our city has ever seen in history, our legislative body is made up of mothers, grandmothers, expectant mothers, and those supporting their partners through pregnancy. This is personal for us, everybody. This is personal for us. For us as leaders of communities who intimately know these experiences firsthand. We've lived this. New Yorkers are looking to all of us for leadership, and it requires approaching this crisis with humility and clarity. While recognizing some progress, we must be honest that there are limitations to the solutions we've advanced and what we can achieve through lawmaking alone. We need comprehensive solutions that require the coordination, collaboration, and sustained investments of all stakeholders: the city, state, federal government, brilliant minds in our public and private hospital systems, university medical schools, community-based organizations, healthcare providers, advocates, and survivors must come together. The problems are well known, in large part because of the strong voices of advocates who have worked tirelessly to put solutions in front of us. We must all move as one, harnessing shared political will to fix the patchwork of challenges that allow so many to fall through the cracks. And that is why today I'm announcing that my office and the entire council will convene stakeholders to leverage our collective power and resources to confront these long-standing inequities that lead to the horror of maternal mortality. We will keep this issue at the top of our priority lists. Our intent is to create ongoing collaboration focused on consistent and coordinated action. There are many notorious issues that deserve our focus, and this work must be guided by experts who can lead us to take concrete actions to achieve maternal health equity. Culturally competent care has life-saving implications. Language access, which has been a barrier, ensures providers can communicate clearly with all patients. Discrimination is another problem. It's well documented that providers are less likely to believe Black women and other women of color about our pain and our symptoms. These biases can have devastating consequences, from patients not receiving proper pain management to loss of life. We can support New Yorkers by also investing in our public hospitals and safety net hospitals that care for those most impacted by maternal mortality. These hospitals overwhelmingly serve low-income and immigrant populations, as well as communities of color. Many patients arrive needing serious medical care and are underinsured or uninsured altogether. Staff are often overworked, understaffed, and under-resourced. The combination of these structural inequities makes it challenging for public and safety net hospitals to meet the quality of care New Yorkers deserve. Our hospitals must be better resourced and prepared to serve their patient populations with pre-existing disparities. Maternal health requires that we not only address physical care, but also the broader determinants of health, accessible mental health services, safety, nutrition, and housing. All of this directly impacts maternal outcomes. In New York City, the leading cause of pregnancy-associated deaths was mental health conditions, with 20 deaths due to overdoses in 2021. This is an alarming statistic that makes clear that the city must do more to focus on postpartum care. We must also consider the comprehensive health and safety of all women before they decide to become mothers. Stressors like poverty, lack of access to health care, including prenatal care, and unstable living conditions can lead to negative health outcomes with long-term implications that contribute to issues during pregnancy. Finally, we need to strengthen the continuum of care because those who are at greatest risk of maternal mortality don't have consistent access to health care in the first place. This requires us to invest more in community-based interventions for low-income women that improve their overall health. Continuity in care can help mothers and providers build trusting relationships while ensuring providers are more attuned to changing health patterns or behaviors that can occur over time. Addressing these long-standing inequities will require sustained focus and ongoing action. The maternal health crisis is a public health emergency, and New Yorkers are counting on us to treat it with the urgency and dignity that our mothers deserve. I will consistently use my voice as speaker to keep it at the forefront of the agenda for our city and bring powerful stakeholders together. We have the talent, we have the resources, we have the tools, and I believe we have the solutions already to change the trajectory of maternal mortality in our city. No one should die from preventable causes, and we owe it to our mothers, without whom there is no life. We owe it to them to get this right. I'm going to encourage everyone in this room, if you have not watched the documentary Aftershock that premiered in 2022, it is available on Hulu. Please watch this documentary and acquaint yourselves with the issue, the preventable issue, the solvable issue known as maternal mortality. And with that, we'll take some on-topic questions. Hi, Ayana.
Who are the stakeholders who you'll be convening for this conversation? And earlier today, I was on the phone with the fiance of Christine Field. She passed away last year at Woodhull Hospital. And the question that he was really wrestling with is, this isn't the first time that the council has brought up this issue and saying that it's urgent. Is there a greater role that the council can play in terms of oversight with Woodhull being a public hospital to really step in because, his concern, he's now consoling, the family of the woman who just most recently died. They feel that this is urgent and, waiting for legislation to be passed or waiting for hearings to happen. It doesn't feel fast enough, soon enough, urgent enough for them. So is there more that the council can do, particularly with this Republican?
Thank you for the questions. I'll take the first one first. As far as who will join us in this working group, in this focus now, we plan to convene representatives from the city, state, and federal government. We need to get these minds all in one place. I think that there has been focus, there have been ideas, but they have been siloed in different places. And now these places seem to be stuck. What do we do with this information? How do we move with this information? Our goal is to get these minds together. We've got to get our public and private hospital systems and our university medical schools, our community-based organizations and healthcare providers, our advocates and survivors together to join us in one mind to move on this issue. The second part, when it comes to healthcare and what's going on at Woodhull, this isn't a Woodhull situation. This is an everything, all hands on deck, all hospitals on deck situation. And I say that because this is not just a New York City situation for Black women, women of color. This is an every state situation for women of color across this entire nation. So I believe that once we get our stakeholders involved and all speaking together in one voice to address this, as we say, as New York goes, everyone else follows as the leader goes forward. We need to be those leaders in this time because, as you said, and we feel it, the urgency in different silos has been there. So I know that the urgency has been there because a lot of us live these experiences. The problem is that the solutions are sitting in different places in space, and we need to bring all of those places together, and that's our intention. Thank you.
Yeah, Speaker,
Bob.
Two-parter. One, we know that at health hospitals, the Doctors' Council has been without contract trying to negotiate an update. One of the things they have complained about is that they're seeing the problem with retention, recruitment in exactly the specialties, neonatal, maternal care, and that the solution from the administration has been to shorten the period of time of the primary consult from 40 to 20 minutes. And then also, the compartmentalizing that happens here isn't this maternal health care crisis part of a national meltdown that came as a consequence of the pandemic, where it was revealed that communities of color in certain zip codes were dying at a much higher rate because people are walking around sicker without care all over this country today. I just don't know how you can say we're going to deal with this one thing when, as Reverend Barber points out, poverty is the fourth leading cause of death in America today. 800 people die on average for lack of things like $35 copay.
Thank you for the question, Bob. And your question is so essential right now. I don't disagree with anything that you just said. There is a health crisis in our country, and you laid it out very well. The pandemic did not help at all. It exacerbated a lot of things that we've always known have been prevalent in our communities for such a long time. What we're going to do here, and I think that in this time, in our space, being led by the first women majority in this council, we have a devastating crisis that has gone unchecked. And while we are going to continue to check all of those other places that you just mentioned, this particular issue is so critical. It is so, in a lot of places, inexplicable that we have the statistics that we have when it comes to what we have known across the years as Black maternal morbidity. We've now shifted the language a little bit, but that's exactly what it is. Black women and women of color dying for something that people would think is very, very simple and natural process for our bodies to go through. we need to get those thoughts and those minds and those solutions together, because we need to conquer this. The larger picture of what you're speaking of will also take a lot of folks together to conquer a nationwide health crisis. But I think that that is another conversation for more brilliant minds like ours in this room as well, and yours, to come together.
So
Yeah.
This is kind of courageous, because what we've been hearing nationally, national debate of the campaign, is that this is happening in the South.
Yes.
We've been hearing about the lack of reproductive care as a problem in Alabama and Mississippi.
Yep.
This council, you're stepping forward and saying, no, this is here.
Absolutely. It's absolutely here in New York City. It's in New Jersey. It's in our northern states. It's in our Midwestern states. It's in the South. It is pervasive across this nation, and it has to stop. Thank you. Hi, Jennifer.
I just want to go back to Woodhull. We'd like to go back to Woodhull Hospital. It's a city-run public hospital. Are there any steps being taken there specifically to ensure this does not happen to another family? And to, which was said earlier today, the safety points, right? Families feel safe going there.
Yeah.
Is there any accountability, any of the doctors, nurses, anyone facing any kind of anything because of what happened in those cases? And would you say that the hospital is kind of going through a maternal crisis on its own? I know it's a larger issue, but that's the one that we have heard the most about in recent years.
Yeah, thank you for the question. You know, again, the crisis doesn't exist solely at Woodhull, although we are not dismissing the issues at Woodhull. We're going to continue as a council to hold our oversight hearings, which is what we're here to do, on those issues, specific issues at Woodhull. Our public hospitals are overwhelmed. They are overwhelmed because of staffing issues, under-resourcing issues. Those are historic issues. We will be addressing specific issues once again in oversight, but I think that we do ourselves a disservice in just isolating Woodhull as being the problem. Woodhull is not the problem. Woodhull, to me, is a symptom of a wider issue that is pervasive across the country.
And follow up with that, what would you say to those families who did lose moms there because of complications with C-sections that they've had when they're in childbirth and had that? And again, I'll just come back to it one more time, because that is the hospital that we've heard most about recently, about these deaths, right? Anything specifically that you can say to reassure those New Yorkers who do go to that hospital, those expected moms who probably will be going there to, deliver their baby, just something comforting to tell them what's happening now, what's being done now. Yeah.
Thank you. With regard to what's happening now, once again, the City Council being a lot of mothers and grandmothers who absolutely feel the pain of lost loved ones, particularly when it comes to pregnancy and childbirth. We will be having our hearings under the leadership of Councilmember Schulman, Councilmember Narcisse, who are well experienced and versed in hospital care. We are going to continue to do our part in oversight, to do our part to remedy the issues at Woodhull, but again, the issues in our public hospital sector overall. Hi.
Can you clarify, lay out what the next steps are? Have you already selected the members of this working group? How often are they going to meet? What are the action items that will be tasked with doing?
Thank you. We have not identified the individuals yet, although we have a good idea of who we want to join us. They will be experts who have been dealing with this issue for a number of years, medical experts. We have spoken with some of the leadership in the mayoral administration that are very, very interested in moving the needle along with the council. So again, this is going to be a collaborative effort among government officials, health experts, medical experts, and advocates who, again, have been doing this work for quite a while, but quite honestly have not known where to place the solutions, the recommendations. We are going to collectively have a central place. It's not going to be done overnight. It's going to take us a while to get there, but we are now going to have a focus and an effort and intentional means to get these solutions so that we can stop this crisis.
Are there specific deliverables for the working group?
We will get the specifics to you as we work through them.
In addition to convening the working group, are there other actions, whether it's legislation, funding, joint action with the mayor's office, that you plan to take in the interim or immediately, just through the normal functions of the council? And secondly, to what extent is the mayor's office and the City Department of Health already looped into this effort and part of that conversation?
Second part of the question first. The mayor's office is looped in like yesterday, and we all agree on this. As far as the other steps to come, legislation, funding, all of that, we're going to be working that through as we work through solutions with the working group as we move forward. And we will give you all the timelines as we progress.
Speaker, Mac with 10
Hi, Mac.
Kind of painted a picture there that little to no progress has been made since you were born, essentially.
True.
Why do you think that is? I mean, it's a big question, but where does that, as you said, racism come from people?
That is an amazing question. As with a lot of things, in our society, in our government, other places, the reasons are systemic. And we know that systems are very, very hard to break. So when we're dealing with systems anywhere, be it public safety, health, transportation, anything, with communities that have been underserved and individuals that have traditionally been looked at as less than, we are going to continue to see these systems act in that fashion that treats, others less than. It's going to be incumbent on us, and I think that we've started to do that, particularly in this council, because of the diversity, because of the experiences that we live, because we are our own constituents, living in this great big world and society, that we have been able to address systems in a lot of different ways. There's so much work to do. When it comes to medical systems, training, attitudes, biases, things that individuals pick up in their homes, at their kitchen tables, even at the water coolers, even there are just mindsets that are there. Folks don't even know they're carrying biases, but clearly certain things come out in the patterns and the practices in everyday life. And I think that's something that we can all agree to. When it comes to health issues, my own, my mother's, my father's, in particular, and talking about my story, women of color are thought to be very, very strong. That's a great thing. But when it comes to our health care and our medical providers thinking that we are stronger than other women, that's just not necessarily the case. So I may walk into a hospital with a headache, and a doctor may say, take 2 Tylenol and call me if you still have the headache tomorrow. Whereas someone else may walk into a hospital and say, I have a headache. They will say, how long have you had the headache? Is it on, what side of your head is it on? We're going to run some tests. There's a very, very distinct difference in that health care. As minute as it may seem and as trivial as it may seem to some of us just take those Tylenol, go home, and don't wake up the next day. So where others will get that extended care, if you will, for that extra hour or so in the doctor's office, those tests will be run. A brain tumor can be found, running a CT scan. That's my medical language for the day. But there is a difference, and that those two instances are not far-fetched. That's real life. Thank you. Check out Aftershock on Hulu. Okay. Thank you all so much for being here.